The truth about black spots on your tongue, myths versus facts. A black spot on the tongue is a common condition that usually appears as a small, dark-colored lesion or patch on the surface of the tongue. While it can be alarming to see, these spots are often harmless and not a cause for concern. However, in some cases, they may indicate an underlying medical issue or infection. There are several possible causes of black spots on the tongue. One of the most common causes is oral hygiene, as bacteria and debris can accumulate on the tongue and lead to discoloration. Other possible causes include smoking or using tobacco products, consuming certain foods or drinks, such as coffee or red wine, taking certain medications, and even stress. In some cases, additional testing may be necessary to determine if there is an infection or other health concern that needs to be addressed. What are the causes and symptoms of a black spot on the tongue? The appearance of a black spot on the tongue can be alarming to some individuals. While it may indicate an underlying health issue, in many cases, it is harmless and will resolve on its own. The most common cause of a black spot on the tongue is oral hygiene habits that are not up to par. Poor oral hygiene can lead to the accumulation of bacteria and debris on the tongue, which can cause discoloration. Symptoms associated with a black spot on the tongue may vary depending on its underlying cause. Some people may experience tenderness or soreness around the affected area, while others may have difficulty eating or speaking due to discomfort. How is a black spot on the tongue diagnosed and treated? A biopsy may also be recommended to confirm the diagnosis and rule out more serious conditions like oral cancer. Treatment options for a black spot on the tongue depend on its underlying cause. In some cases, such as if it is caused by smoking or tobacco use, quitting these habits can help improve symptoms. If it is due to a bacterial infection or poor oral hygiene, antibiotics or improved dental care may be prescribed. In rare cases where the black spot is indicative of something more serious like oral cancer, prompt treatment such as surgery, radiation therapy, and chemotherapy may be necessary. It's important to consult with a healthcare professional if you notice any unusual changes in your mouth or tongue. Tips for prevention and ways to minimize the chances of developing a black spot on the tongue. Preventing black spots on the tongue starts with good oral hygiene practices. One way to do this is by brushing your teeth twice a day and flossing regularly. This helps to remove any bacteria or food particles that may cause discoloration on the tongue. Another tip is to avoid smoking and excessive alcohol consumption, as these habits can increase the likelihood of developing black spots on the tongue. Drinking plenty of water throughout the day also helps keep your mouth hydrated, which can reduce bacterial growth. If you notice any changes in your mouth or develop a black spot on your tongue, it's important to visit your dentist for an evaluation. They can determine if there are any underlying health issues contributing to the discoloration and provide appropriate treatment options. By practicing good oral hygiene habits and being proactive about seeking dental care, you can minimize your chances of developing black spots on your tongue.